Let me start recording. Perfect. So I was going to give everybody a little bit of time to get logged in and everything, but it's about 2:04, 2:05. You're the only one here so far, Adrian. So we're going to go ahead and get started. Before we jump into what we are doing today, I just want to ask you, was there anything from the last lecture that you wanted me to go over again or explain again? Did you have any questions about either the digestive or the respiratory systems?
No questions about either of them. Respiratory was a little bit difficult, but I'm still studying that at the moment.
Okay. Well, if you come up with any questions, just shoot me an email or something. I'll be happy to answer it for you. So today we are going to
Appreciate
cover.
it. You do really good lectures, though.
Oh, thanks. So we're going to cover chapter 13 today. So we are going to be on page 506, 507. And this isn't a super long chapter, and a good bit of this chapter is just kind of talking you through a couple of procedures. So as you flip through the chapter, it's not going to be terribly dense. I think most of your mental energies this week is going to be spent on the anatomy stuff. This one is just kind of a nice, easier chapter to get through. But the topic on this one is cold, heat, and hydrotherapies. So what we are talking about is the use of cold, heat, or water to promote some kind of beneficial or therapeutic change to the body. So let's begin by defining a couple of terms. The first one that I want to make sure that we've got covered, it's in the dead center of the first paragraph. It says the therapeutic use of water is termed hydrotherapy. Thermotherapy is the use of heat for therapeutic purposes, and cryotherapy is the therapeutic process of cooling the body. Now, of course, we're going to put fancy technical words on some of these things, but the application of these is dead easy to understand, and it's most likely something that you've used once or twice in your life before. If you've ever laid on a heating pad, or if you've ever put ice on an injured body part, you've done thermotherapy and cryotherapy. Hydrotherapy is going to be the therapeutic application of water in any of its forms to the human body for therapeutic benefit. So when we say in any of its forms, we're talking about steam, right? The vapor form of water. We're talking about the liquid form of water. Think a jacuzzi or a hot tub. Or we could be using ice or some kind of like ice bath where you dunk the body into really, really cold water. A lot of athletes do that after intense games or really intense workouts, just to lower the body temperature overall, reducing any inflammation that had started to develop during their training. So with those three terms in mind, and again, we're using fancy words, but all we're really saying is therapeutic application of water in some form, the application of heat, usually a dry heat, even the hydrocollator packs that we have in our hands-on room, those wet packs that I have to keep refilling the water on, that would be a form of thermotherapy. And cryotherapy is the use of ice to cool the body down. So this chapter, chapter 13, we're going to be talking about several different hydrotherapy methods. Many of them are very popular offerings in spas. So we're going to be talking about a few procedures like wraps, baths, showers, and salt glows. Now, the thing is, we're going to talk about these and we're going to get a basic understanding of some of these services, but most spas are not equipped to perform these kinds of services. The ones that are going to be what we call wet spas, meaning the spas that have shower facilities and hot tubs, and you're giving clients soap and a shower and a locker to put all their stuff into. Most areas that we go to work in are what we call day spas. Day spas are used, it's for one day kind of thing. Like you come in, you get a service, you leave, and you go home. You're only there usually for a couple of hours. So if you're working at a Massage Envy, Hand and Stone, Essentials, those kind of franchise places, those are going to be categorized as day spas. Most of them will not be equipped to perform most of the services that we're about to talk about. So moving on to page 508, on to the next page, it says explain hydrotherapy. Highlight the first sentence. Hydrotherapy is the application of water in any of its three forms, solid, liquid, vapor, to the body for therapeutic purposes. Hydrotherapy is a very effective modality, especially when we add it to some kind of massage. So the reason that it is therapeutic is because the application of water in one of those three forms will create specific changes in the body. Now, those changes are not only reliable, but they are predictable. And if I know the kind of change that I can create in the body, then I can apply that change strategically for the benefit of the body. That is what we mean when we say therapeutic, right? It's applied for the benefit. So hydrotherapy's effects on the body, these changes can be classified in three ways: thermal, mechanical, and chemical. Thermal, the word therm or thermo relates to heat. So thermal changes are those changes that occur as a result of the temperature change. Thermal effects are produced by applying water at temperatures either above or below that of the human body. This is going to be done by baths or wraps or packs that we apply that raise or lower the temperature of the body. Mechanical effects are the effects or the changes that take place in the body as a result of the physical pressure being applied to the body. So if you've ever sat in a jacuzzi and turned those water spouts on and you felt how relieving it is to have that water blasting onto your back muscles, that is a mechanical effect. Again, it's produced by the pressure exerted on the surface of the body by sprays, whirlpool baths, frictions, things of that nature. Lastly, we have chemical effects. Chemical effects are caused by whatever chemical we add into the water. So if you put someone in a bath and you add essential oils, whatever effect the essential oils have, that is the chemical effect of the hydrotherapy treatment. We can also add other things like herbal preparations or Epsom salt, baking soda, things of that nature. So again, thermal effects are the effects caused by the temperature change. Mechanical effects are those effects that are created by the physical pressure of the water blasting onto the human body. And chemical effects are the effects of whatever chemicals that we add to the water, like essential oils or baking soda or Epsom salts, what have you. Now, again, the reason that these things are therapeutic is because the body will behave in very predictable ways to the application of these treatments. And when we can predict the kind of response the body will have, we can then use those treatments to elicit desired results from the body. So the temperature of the water will affect the body. Therefore, understanding how the temperature relates to the body, how the temperature will change the body, becomes very, very important for us to understand what kind of changes that different temperatures will have on the body. Now, again, this is probably the billionth time we have said this in a massage class, but normal body temperature is 98.6 degrees Fahrenheit or 37 degrees Celsius. The surface temperature of your skin is about 92 degrees Fahrenheit. So when you stick the thermometer under your tongue and it says 98.6, that's normal. But if you were to hold the thermometer just on your skin, it would be about 92. So water temperatures are kind of laid out in a box at the top of page 509. The box is called Massage Corner 13.1. And we've got a description of the temperature, a reading measurement of the temperature, like what it is in degrees, and then what kind of sensation that the person will experience when you apply water of that temperature to the body. So I'm not going to go through all of these, but just to give you a few key points, you look at the very first one, right at the very top. Freezing water is going to be 32 degrees or 0 degrees Celsius, and the sensation is intolerable or dangerous. You don't really want to keep ice directly on the body. You want to put some kind of barrier in between, like a towel or a cloth. And if you're going to submerge someone in ice water, you don't want to do it for very long, right? You dunk them in, get them cold, pull them out. I'm going to slide down the list just a little bit because, again, it's every single one of these is overkill, to be honest with you. Let's say neutral. A neutral temperature is about 93 to 98 degrees Fahrenheit. When you stick your hand in water that temperature, it's comfortable. You don't really feel much of anything. It's about exactly the temperature as your skin, so it's a very easy temperature. And then we have hot, which is 99 to 104. It's like a hot bath. It's tolerable. You can slide your body into it, and it's hot, but you enjoy it. You know, it's nothing too extreme. Now, 105 to 110 degrees, that is very hot. That would be something like a hot tub. You can withstand it for a period of time, but you can't hang out in there forever. Eventually, you're going to get too hot. You got to get out. Over 110 degrees is painfully hot. It would be intolerable to put yourself into a tub that was hotter than 110. It's just too hot. It would be too much. Now, there's an important point that I just want to make really quick, because when we are doing something like hot stone massage, those stones are usually about 120 degrees. But this is the difference between a local application and a full body application. 120 degrees is too hot to dunk your entire body into, right? To submerge the body. It is not too hot to do a local application. So if I take a hot stone and use it to massage the body, and that stone is 120 degrees, only that area that is touching the skin is intolerable. And as you're moving that stone around, it becomes very tolerable. Dangerously hot, you're approaching over 125 degrees. Something like that could start to burn the skin. So obviously we don't ever want to put anything, or submerge the body in anything that's hotter than that. To give you kind of a mental image or a bookmark, if you've ever been in a hot tub, standard temperature for a hot tub is 104 degrees. So if you've ever been in a hot tub, that's what 104 degrees feels like. It is hot, for sure, but it's not too hot. It's not intolerable. Okay. So we're going to move on down to the next section. It says, articulate the use and effects of applications of heat and cold. This is at the bottom of page 509. Again, it starts out by telling you for the billionth time, normal body temperature, 98.6 degrees Fahrenheit or 37 degrees Celsius. So if the water is the same temperature as body temperature, there are no thermal effects, which kind of makes sense when you think about it. Thermal effects are created by applying temperatures to the body that are above or below normal body temperature. So if you're putting the body in water that is right at body temperature, it doesn't feel hot, it doesn't feel cold, you don't get any thermal effects. Now, if we were to put you in a room temperature jacuzzi, or I'm sorry, a body temperature jacuzzi, you could still get the mechanical effects of those jets blasting onto your skin. You could still get chemical effects if you added essential oils or something into the water, but thermal effects would be absent because thermal effects are rooted in temperature. So I want you to highlight, starting at the third sentence, I'm going to read the first two. If the temperature of the treatment is the same as body temperature, there are no thermal effects. Treatments of short duration have different effects from longer duration. Start highlighting, for example, a short application of cold, 2 to 5 seconds, has a stimulating effect, whereas extended application, 10 to 30 minutes, depresses metabolic activity. And you've probably had some sense of this in your daily life. I mean, I'm sure at some point somebody has pulled the joke on you where you're just standing there unaware and they stick an ice cube on the back of your neck and the response is like, you jump up and okay. When you jump up and you tense up, that was stimulating. A short application of cold has a stimulating effect. But if you've ever soaked your sore arms in ice water, and trust me, after you've been doing massage as long as I have, you do 7 massages a day, you go home, you're going to soak those babies in ice water. They just hurt. After a few minutes, you don't really feel anything. The cold just kind of makes them go numb. That would be a sedating effect. Local applications will have specific local effects. So if you soak the hand has a change, but not the rest of the body. Whereas full body applications will have systemic effects. So if you soak the feet, only the feet are affected. If you soak the whole body is affected. And the physiological effects that heat and cold have on the body are predictable, which makes their use a powerful therapeutic agent. Now, if we're using more extreme temperatures, like really hot water or ice or really cold water, the treatments that use these extreme temperatures of either short or long durations should be avoided or used under very close supervision. Using thermal treatments below freezing or above 115 degrees Fahrenheit can damage the tissues. Highlight: prolonged general treatments below 70 degrees can cause hypothermia. Prolonged general treatments above 104 can cause hyperthermia. Either condition is potentially dangerous. Keep highlighting. The application of heat causes vasodilation, which is a widening of the blood vessels, and a circulation increase in an attempt to dissipate the heat. So think about this real quick. Have you ever put a hot pack on your body or held something warm against the skin? And give it a few seconds. When you take that warm thing away, the skin that was in contact is now red. You're seeing the effect of what we just described. The heat causes those blood vessels to get larger, which pulls more blood into that area. Blood is red, so when you get a lot of blood in the tissue turns red. A whole body application of heat rises body temperature, which causes a fever-like reaction. There is profuse perspiration, a lot of sweating. The pulse rate increases. Red and white blood cell count increases. Highlight: a local application of heat causes a local reddening caused by vasodilation. The reddening is caused by these enlarging blood vessels. Increased metabolism and leukocyte migration to the area. Leukocytes are white blood cells. So you put heat on an area, it pulls white blood cells to that area. It also causes relaxation of the local musculature. Super handy thing to have in under your belt as a massage therapist. You put heat on a muscle, it relaxes the muscle. And a slight analgesia. Analgesia is pain relief. So putting heat on an area relieves pain. Please make sure you highlight the 2 terms in the margin on page 510. These terms are bursitis. We spoke about this briefly when we were talking about skeletal system. Bursa are those little sacs of synovial membrane that we tuck inside of certain joints to protect areas where muscle is contracting over bone. And the second term is neuralgia. Neuralgia is a medical term. The word tells you exactly what it is. Neur means nerve. Algia is a painful condition. So neuralgia is a painful nerve condition. Your nerves hurt. It is acute pain along the course of the nerve. All right, good stuff so far. Any questions, any concerns, comments? What we've done so far?
No questions.
Okie doke. Well, Adrian, you are the only one in class so far, so you've got me to yourself. So if you get any questions, feel free to jump in, because God knows we got nothing but time.
You got it.
All right, so predictable reactions to water applications. These are summarized in the box at the bottom of page 510. Now, please do not think I want you to memorize each and every one of those. This is insane. This is a reference, right? So look at it when you need to look up what the response is going to be. But a lot of these, once you kind of get the hang of hydrotherapy, you understand the way temperatures will change the body. this reference sheet just becomes intuitive. I mean, you could just take a good guess and you would most likely be right. So what we're looking at is between different body parts, what kind of changes will happen during the initial application of cold? When you first put cold on the body, what kind of change happens? Then we have prolonged cold. What happens when you leave that cold object in contact with the body? Initial heat, what happens when you initially put heat on the body? And then prolonged heat, what happens when you maintain the application of heat? So let's look at circulation very briefly. When you initially put cold onto an area of the skin, it reduces circulation. If you keep it there, it will decrease circulation even more. So putting cold on an area reduces circulation. This is why we only put ice on inflammation. Inflammation is an increase in the flow of blood. So when you put ice on the swelling, it reduces the flow of blood. It undoes the effects of the inflammation. Now, initial heat and prolonged heat will both increase circulation. This is why we don't put heat onto inflammation, because there's already too much blood in that area. That's why it's red and swollen and painful. So when you put heat on that area, you're just pulling more blood. You're aggravating the condition of inflammation. You're making it worse. So we do not apply heat onto inflammation. Again, when we look at heart rate, initially, cold increases heart rate, just like when someone sticks an ice cube on the back of your neck, your heart rate goes up real quick. But if you get dunked into really cold water for a long period of time, it will lower your heart rate. Initial application of heat feels really good. It decreases heart rate, right? It's kind of relaxing. But if you stay in that application of heat, it will eventually increase your heart rate, because your body will have to work overtime pumping blood, trying to get blood to the surface of the skin so we can dump off some of that excess heat out into the air. Respiration, metabolism, chronic pain. All right. I'm not going to read everything in that box. You can read it for yourself. You're an adult. But as we move through the chapter and we learn more about this stuff, when you refer back to this box on page 510, as you go through each body part, the results or the effects will start to be a little more intuitive. You can start to take a good guess, and you'd most likely be correct. We're going to move on to contraindications for hydrotherapy. Just like any other treatment in massage, certain conditions preclude the use of hydrotherapy or cryotherapy. So some of the conditions that we want to avoid using hydrotherapy on are going to be things like cardiac impairment. If their heart isn't working properly, we don't want to do anything that's going to increase or decrease their heart rate. The heart is already having a problem maintaining its rhythm. Another concern is with diabetes. In the advanced stages of diabetes, many patients will develop a condition called diabetic peripheral neuropathy, which causes the nerves in your hands and feet to stop functioning properly. They lose sensitivity. The problem here is if you put a diabetic person into hot water, they don't feel it as effectively as a normal, healthy person would. So if they can't feel the heat, they can't tell you if it's too hot. The risk here is that you could be burning them and they don't feel it. So they don't tell you that it's too hot. So you're burning the client. Meanwhile, you have no idea and they have no idea until they start showing up with burn blisters all over their body. Lung disease would be another contraindication. When you look at that chart on the previous page, respiration, cold and heat, almost all of those decrease respiration. Prolonged heat will increase it. If they have lung disease, their lungs aren't working at full capacity. So anything that is decreasing respiration, they're not getting the oxygen that they need already. You don't want to go decreasing respiration, getting them less oxygen when they're already working with less oxygen. You're just going to aggravate that condition. As with cardiac impairment, if the heart isn't functioning normally to get the blood circulating, we don't want to do anything that's going to impair circulation. So if they have a kidney infection or some kind of kidney disease, We also don't want to do anything that will change circulation because kidneys filter the blood. So if you aren't getting enough circulation to begin with, you don't want to go doing anything that will increase circulation. You're going to overload the tissues, right? When you increase circulation, you increase the amount of waste product in the blood. Remember, cells poop in the river. So when you increase the flow of the river, you increase the amount of poop in the blood. So by the time the blood gets to the kidneys to get filtered out, if the kidneys are compromised through kidney disease, they won't be able to handle the extra load of all the waste products in the blood. So kidney disease, cardiac disease, respiratory illnesses, diabetes, extremely high or low blood pressure. We don't want to deal with any of that stuff, not with hydrotherapy. Another concern is infectious skin conditions. You don't want to go putting somebody in your hot tub if they have an infectious skin condition, right? You're going to infect anybody who goes into the hot tub after that. And then any other kind of open wound on the skin. Again, you don't want people bleeding into your hot tub. So if they have an open wound, don't work on it. Don't put ice on anything. Don't put heat on anything. Don't put, any kind of open wound is going to be a contraindication for almost any form of massage, except possibly energy work, because you're not actually touching them. All right, so moving on to the next section, it says cryotherapy. We defined this term already, but here it is in the textbook. We can go ahead and highlight the definition in the margin. Cryotherapy is the therapeutic application of cold to the human body for therapeutic purposes. Now, this could be an ice pack, or this could be straight up ice. This could be dunking a body part into very, very cold water. It doesn't necessarily have to be ice. It just has to be the application of cold in general. The primary goal of cryotherapy, and don't mean to blow your mind here, but the primary goal of cryotherapy is to reduce the temperature of the tissue. I know. Whoa, what? Reducing temperature by putting ice on the body? What? But as you put ice on the body, it draws heat out of the tissue, cooling the tissue. This cooling will have the effect of reducing pain, reducing inflammation, reducing swelling. It also acts as an analgesic, as a pain reliever, to reduce inflammation, and it causes vasoconstriction, which is the blood vessels getting smaller. Vasoconstriction and vasodilation are two opposite things. Vasodilation is the blood vessel getting larger, bringing in more blood. Vasoconstriction is the tightening or the shrinking of the blood vessel, reducing the flow of blood to that area. This has the effect of limiting swelling and reducing pain. Now, a secondary effect of cryotherapy, because of this vasoconstriction, when you put cold on the body, the blood vessels constrict, they get smaller, it carries blood away from the tissue. But when you remove the cold, those vessels will open up again, bringing more blood into the area. This blood that comes in will be fresh blood, arterial blood, full of oxygen, full of nutrients. So we improve circulation to the area by applying cold. We also improve cellular nutrition and metabolism in that area. By bringing the nutrients, they eat. And when they eat, they poop. And the whole cycle of eating and pooping for a cell, that is metabolism. Now, extreme cold, we're talking about applying something like ice directly to the skin. The application of extreme cold should be kept to short durations. The risk here is tissue injury from freezing. Under the heading of extreme cold on page 511, we're going to start to highlight. We're going to highlight this whole paragraph, so get ready. Start highlighting. The application of ice causes a series of sensations that can act as indicators during the duration of the application. The first sensation is cold. Following the cold sensation comes burning, followed by aching. The next is numbness and the cessation of pain. This is the analgesic effect. When the fourth stage is reached, application should be temporarily suspended in order to prevent injuries to the tissues. These series of sensations can be represented by the acronym CBAN. CBAN is cold, burning, aching, numbness. Cold, burning, aching, numbness. Treatment can be repeated as necessary as often as once an hour. So if you're applying ice to a person's body, their initial reaction is going to be the sensation of cold. I know, again, I'm blowing your mind with knowledge here. But when you put ice on the body, it feels cold. But if you've ever been outside or held onto an ice cube for a long time, and if you haven't, give it a try. You will go through the phases of CBAN, firsthand experience. The first thing you'll feel is cold. But as you continue holding on to that ice cube, the sensation of cold will soon give way to a burning sensation. Eventually, that burn will start to simmer down and it will turn into more of an ache, right? It doesn't burn, it just hurts. It's just a general pain. And then the pain goes away and suddenly that tissue is numb and you can touch it and rub it and you really don't feel anything. That is the analgesic effect, the pain relieving effect. Now, once you get to the numb stage, take the ice off the skin. That is your boundary line. Once the skin goes numb, the treatment needs to stop for just a little while. We need to encourage blood flow back to the area. You can retreat with ice again in as often as an hour, but you want to stop the treatment once you get to that numb stage. Now, ice is used often as a first aid for traumatic soft tissue injuries, so things like sprains or broken bones. Ice is usually part of the first aid treatment. Under price first aid for soft tissue injuries, start highlighting the second sentence. When a soft tissue injury, such as a sprain or strain, occurs, the standard first aid treatment is to apply RICE, R-I-C-E. RICE stands for rest, ice, compress, elevate. This will have the effect of reducing the swelling and reducing the secondary tissue damage that results from the inflammation. Now, for years and years, everybody who has done any kind of first aid training knows the acronym RICE. It's so ingrained in first aid training: rest, ice, compress, elevate. But just a couple of years ago, they added a P onto the beginning of that acronym. The P stands for protect. So now the new acronym is PRICE. Now, why did they feel the need after all these years to change the acronym? I don't know. I guess they felt the need to sell more textbooks or something. But the important takeaway is this. When it comes to first aid treatment, the treatment that we often use for for soft tissue injuries is the PRICE method. You protect the area from further injury. You rest the injury, try to keep weight off of it as much as possible, try to take it easy. Apply ice to the area to reduce inflammation. Compress the area, wrap it in a tight bandage. This tight bandage keeps pressure on the tissue, which prevents inflammation from building up over time, right? That compression squeezes out the extra blood. And elevate. What we mean by elevate is to elevate that area above the heart level. You want that blood to have to go uphill to go from the heart to the damaged area. So by elevating the injury, if you're talking about something like a leg or an ankle, you lie the body down supine, and then you raise the ankle up above heart level so that the blood coming from the heart has to go uphill. It needs to go up an incline in order to reach the damaged area. If we were talking about injury to an elbow or a wrist, you would hold the wrist, usually using some kind of sling or something, but you would hold the wrist above heart level. Again, you got to make that blood go uphill to get to the damaged area. This will, again, you reduce the circulation of blood, you reduce inflammation, which thereby reduces further tissue damage. We're going to slide down to the last sentence in this section. It says, highlight this. One of the best ways to increase circulation to an area to promote healing is the application of contrast therapy, which is the alternate application of heat and cold. In my personal experience, I have done this myself many times. I could not recommend contrast therapy enough. It is wildly effective at treating soft tissue injuries. So the general procedure would go like this. You start with cold. You apply cold to the area, usually for something like 15 to 20 minutes. You take the cold off, and then you apply heat, usually putting in a hot water immersion or using something like a hot pack or a heating pad or a hydrocollator pack, something of that nature. But you apply heat to that same area, again for 15 to 20 minutes. Then you take the heat off, you apply again cold for 15 to 20 minutes. And then you just alternate 15 to 20 minutes each. You start with cold, you switch to heat, you go back to cold. You can repeat this for as long as you have the time to, or as long as the client needs it. But you always want to end on cold. You always start with cold and end with cold. This is because, again, the thing you're trying to avoid is inflammation. If you end with heat, you're ending with all the blood being pulled into that area. The vessels are dilated, the area will be warm and red. You're basically creating the inflammation that the body is trying to create on its own. We don't want to do this. So you end your contrast therapy application with ice. This leaves the area with those blood vessels constricted, reduced blood flow, and now as the body restores normal blood flow, it's going to be more along normal lines, not on those heightened inflammation lines when you talk about the amount of blood in the area. Highlight the definition in the margin of page 511. Highlight cryotherapy and contrast therapy. Cryotherapy is the application of cold for therapeutic purposes. Contrast therapy is the alternating application of heat and cold for therapeutic purposes. So contrast therapy has a secondary benefit, an additional benefit. It doesn't just prevent inflammation. There's another really cool thing that contrast therapy can accomplish. And the term that they use to describe it is called a vascular flush. The first word, vascular, you're referring to vessels, blood vessels. So a vascular flush basically works like this. Think back to the analogy that we talked about with the blood flow being like a river, and the cells live by the river, and every day they walk to the river, they throw in their garbage, they pick up their groceries, right? They trade off their nutrients for their waste products. They pick up nutrients, they expel their wastes. So this river that runs by your house, you go out there every day, you pick up your groceries, you dump in your garbage. And this river is always flowing. There is never a moment where blood flow just stops. Well, except when you die, but blood flow never just stops. The river is always flowing. But when we apply cold to the area, we said we reduce the flow of blood. So that river dries up into just a little creek. When we put heat on the area, the river opens up. Now we've got a wide, deep, fast river, bringing us lots of nutrients and lots of oxygen. By applying contrast therapy, alternating heat and cold, basically what you're doing is when you apply heat, you bring in a large amount of blood into that tissue. It flushes the area with fresh, red, oxygenated, nutrient-filled blood. The cells take in their fill, then you put cold on the area. It dries up the river into just a little creek. So all of that blood gets pushed out. All of the stagnant blood gets pushed out. 15 to 20 minutes later, what do? We put heat on the area. We open that river up again, flood the tissues with fresh blood, and then we put cold on again. We dry it up, pushing all that blood back out. The results of this vascular flush, this repeated application of cold, then hot, then cold, then hot, is that this area of tissue gets a complete circulation of blood. All of the old blood gets pushed out. All new, fresh blood gets brought in. We dump off nutrients, we pick up waste products, and then we do it all again. All that blood gets washed out. All the deoxygenated, waste-laden blood, all that stuff gets pushed out with the application of cold. Then we apply heat. We bring in a bunch of new, fresh, red blood. All the cells get their groceries. They dump in their garbage. And then we put cold on the area. We flush all that blood out, carrying all the waste products away, and then we repeat this cycle over and over and over again. Usually contrast therapy is done for about 30 minutes to an hour, but that's just a typical You could do this for 5 minutes. You could, if you've got time at your house, and I know everybody's on quarantine, we got nothing but time, you could sit there for 5 hours and do contrast therapy. There's very little risk, except for those people that we mentioned earlier that are contraindicated. But if you're healthy, there is no real risk to contrast therapy. In fact, it's only going to improve circulation to that tissue. So one more time, just to quickly recap, contrast therapy, we're talking about 15 to 20 minutes each. You start with cold, switch to heat, switch to cold, switch to heat, 15 to 20 minutes each. You always finish with cold. Good stuff? I'll take that as a yes. Good stuff. All right, moving on down, the effects of cold. Cold applications are valuable in affecting circulation, sedating the nerves, slowing metabolic activity of body cells. The prolonged use of cold will have a depressing effect on the body and must be used cautiously and under supervision. Highlight: the effects of local cold applications are manifested in the following ways. Highlight all of these. I would just draw a line down through the numbers so you don't waste all that ink highlighting each line, just highlight the numbers. The skin becomes chilled, surface blood vessels constrict, and blood is driven to the interior of the body. Oh, sorry, I lost my place. These numbers pick up here at the top of the next page. I lost my place on that one. Number 3, nerve sensitivity is reduced, reducing pain. Number 4, the metabolic activity of local cells slows. Number 5, spasticity, that is having muscle spasms. Spasticity is reduced due to decreased gamma motor neuron activity. They just threw that in there just to confuse you. Cold reduces muscle spasms. We'll leave it there. And number 6, inflammation and swelling are reduced. Secondary tissue damage is reduced. Now, to apply cold to the body, we have a couple of different options. We have a cold compress, which is little more than a washcloth dunked in cold water. You wring it out and apply the cold wash towel to the body. That is a cold compress. You also have ice packs. You can create them yourself using a Ziploc bag or a towel, or you can purchase a commercial ice pack. These would be filled with some kind of gel that you leave in your freezer. The gel gets really cold, but it stays malleable so that you can still bend the pack to conform it to some area of the body. We also have ice massage, where you actually take ice and you massage the body with a piece of ice. That, like, the ice is your tool. You're applying the ice cube directly to the body and then massaging with it. There's a photo of one of these types of it's a special cup that we use to do ice massage. There's a photo of it later in the chapter. I purchased one a while ago. They're no more than like $10. They're not expensive at all. Then we also have compressor units with thermal packs and controls. It's going to be a fancy piece of equipment that blows really cold air onto the body. There's also vasocoolant sprays. This is a spray type mechanism, so it'll be in a small can with a button, like hairspray. It sprays. But what it's spraying is this material that has a very, very low evaporation, a very low evaporation temperature. So you spray the liquid onto the skin. About 92 degrees is good enough. About that temperature, that liquid will evaporate very quickly, and that evaporation takes heat with it, leaving the skin feeling cool. So those vasocoolant sprays work on the same kind of principle as if you've ever taken a hot shower, you turn the shower off, you open the shower curtain, suddenly you're really cold, because all of that warm water that is stuck to your skin starts to evaporate. And as it evaporates, it takes a little bit of that heat along with it. Pulling heat away from the body leaves the body feeling colder. That is why you get cold after a shower. So these vasocoolant sprays, you spray them onto the skin, they evaporate very quickly, it leaves the skin feeling very cold. Those are used a lot of times in sports massage and stuff. And then we have immersion baths. An immersion bath is where you take the whole body and you immerse it in water. Think of a hot tub or a pool or anything like that. Anything where you are submerging the body in water, that is an immersion bath. So I kind of explained them as we went. Now your book is going to go through one by one and explain them more thoroughly. But you know what? I think I did a good job of explaining them just through their little bullet list. So I'm going to move along kind of quickly through this next section. Follow me along here. We're on page 512. Under the section heading cold compress, I do not have any highlights for you. We're going to move on to the next section. It says ice pack. Highlight the first sentence. Ice packs are used for the local application of ice on a specific body part. Pause highlighting. Ice packs are effective in relieving pain, preventing swelling, and reducing inflammation. They are indicated for early treatment in the acute stage of sprains, strains, and other soft tissue injuries. Highlight. They are also effective in the treatment of acute joint and nerve inflammation. Stop highlighting there. The next paragraph gives you instructions on how to make your own ice pack. You can also just buy them. We have reusable ice packs, and then we have reusable commercial ice packs. There's a highlight in here, so follow me along. Reusable commercial ice packs are available in a variety of types and sizes. These are usually in a sealed plastic pack containing a chemical gel. This pack is stored in the freezer until needed. The pack is wrapped in terry cloth to prevent direct contact with the skin. Highlight. Direct contact is unsanitary and can also result in injury from freezing the tissue. So these ice packs, when they come straight out of the freezer, obviously they're super cold. You don't want to put them directly on the skin. That is too cold for the skin. You want to put some kind of wrapping on it, like a terry cloth wrapping or a sock, or wrap it in a towel or something like that. You also don't want it to directly contact the body because that's unsanitary. You don't want to be moving this ice pack from body to body to body without, if you did that, you'd have to sanitize it in between. You have to spray it with a cleanser and wipe it down. And, you don't have to do all that stuff if you just wrap it in a towel. So then when you take it off the client, you take it out of its wrapping, you throw it back in the freezer for the next use. Next page, ice massage. I don't have any highlights on this page, but there are some things that I want, like some of these pictures I want to pull your attention to. So let's start with looking at picture 13-11 on the bottom left-hand corner. That is the special cup that I was talking to you about earlier. These cups are very frequently used for sports or athletic massage, or for any kind of therapeutic modality. So the device is, it looks just like a small cup. They're usually only maybe 3 or 4 inches high, so they're not very large. They're about the size of like the kind of cup you'd keep in your bathroom just to take a swig of water or something when you're brushing your teeth. Not a very large cup. But the top portion of the cup is a detachable ring. And that ring has tiny little plastic spikes that stick in towards the center so that when you fill it up with water, you put this thing in your freezer, the ice forms around those spikes. Then what happens? You take the thing out of the freezer, you grab the bottom part of the cup, you twist and pull it off. Now what you are left with is that top ring with the ice forming the rest of the shape of that cup, and those little spikes up in that ring are holding the ice in that ring. So it's holding the ice in place. Now you've got a nice little handle, and then you've got this entire piece of ice sticking out, and you would use that as your tool. So you would use that ice to massage the body. In the next photo, figure 13-12, there's that little ice cup again, but you also have a tool that is made of a small piece of metal with a nice cushiony foam handle. So you put that thing in the freezer, you let it stay in there for a good while, and then when you take it out, you've got this cushion handle to hold on to, but a really, really cold metal tool that you can now use for something like trigger point work, or acupressure work, where you have a firm tool that you can use to poke and press and twist. So you use that as your tool on the body. If you're too cheap to go buy one of those cups, and many people are, you could also use little Dixie cups, little paper cups, like you buy a sleeve of them to do like mouthwash and stuff with. Basically, you fill them up with water, you freeze them, and then you start at the top, you peel off like the top inch or so. Now you've got the bottom part of that paper cup that you can hold on to, the top part of the ice, which is frozen and sticking out, and that is now the tool that you use to do massage with. And then when you're done, it's just a paper cup. You just throw them away. Easy peasy. And then figure 13-16, the bottom picture on page 515 shows you an image of how you would do that. You would apply ice onto some area. So, moving on to the next section at the bottom of page 515, this section says immersion baths. There's a highlight in here, so follow me. It says the entire body or a body part can be immersed in cool or cold water. Cold plunges are available at some spas and gyms where patrons can dip into a cool pool, haha, after being in a hot tub or sauna. Highlight. When working with an extremity, such as a foot, ankle, hand, wrist, or elbow, an immersion ice water bath can be used to reduce inflammation. Stop highlighting there. Prepare a basin or tub with 40% ice, 60% water. Submerge the body part in the ice water until the feeling of cold or pain stops, and then remove the body part from the bath. Again, you immerse the body part until the pain stops. We're going back to that phrase C-BAN, cold, burning, aching, numb. When it gets numb, we stop. All right. Page 516 describes thermotherapy. So now we are looking at the therapeutic application of heat. Highlight the first sentence for me. Thermotherapy is the application of heat to the body for therapeutic purposes. Stop highlighting after that first sentence. Thermotherapy may use technologies other than water for delivery. So thermotherapy may or may not be considered hydrotherapy. And a good example of a non-hydrotherapeutic therapeutic application of heat would be something like a table warmer. No water involved, therefore it is not hydrotherapy, but it is using heat, so it is thermotherapy. Heat can be transferred to the body in one of four ways. So four main ways that we can get heat into the body. And those four ways are conduction, convection, radiation, or conversion. Use your highlighter, draw a line through all four of those numbers. Just highlight 1, 2, 3, 4, because you're going to need to know all of those. But let's start with the first one, conduction. Conduction is the direct exchange of heat when the surface of the body is in direct contact with the thermal agent, like the immersion bath or a heat pack. Think about conduction as putting a pot of water on the stove. Where's the heat source? The stove. Where's the pot? On the stove. So why did the pot get hot? Because it's touching the stove. That heat is directly conducted into the pot, heating the water. So conduction, we're talking about direct contact with the heat source. Convection works a little bit differently. Convection is the transfer of heat through the movement of the air. So this would be something like a sauna. If you've ever been into a sauna, it's one of those dry heat rooms. You walk in, it is stupid hot in there. But you're not touching anything hot. The air is hot. That is where you get the benefit of the heat. If you've ever used a convection oven, like to bake a cake or something, a convection oven doesn't just use the heating element. There's a fan in there that circulates the air so that the entire oven stays at roughly the same temperature. That heat creates convection currents. So convection is done through the air. We're talking about steam or a sauna. Radiation, number 3, is the transfer of heat by way of rays that are contacting the body. So if we're talking about being heated by rays, the best example is the sun. When you walk outside into the sunshine, you immediately feel the warmth of the sun. That is because the sun is emitting infrared rays. Infrared heats things up. That is why the sun heats things up. So there you go. The last one is conversion. Now, conversion is converting an energy source into heat as it passes through the body's tissue. This one is a little more rare. It's a little more, it's a lot less common, but a really good example. They say diathermy. That's really not very common. A more common one is ultrasonography. I'll talk to you a little bit more about ultrasonography in just a minute. The effects of heat applications, super important. Read that section. I don't have any highlights, so I'm going to move on. Sources of heat application. Where can we get heat applied to the body? Well, there are several sources for heat application. Let's start at the top of page 517. First, we're looking, we can divide all heat applications into either dry heat or moist heat. So let's start with dry heat. Dry heat, we're looking at like a heating pad. We could also be using infrared radiation, kind of like the sun. We could be using diathermy, which uses magnetic fields to create heat, or ultrasonography, which uses ultrasound waves. Same kind of ultrasound waves as like women get when they're pregnant, right? And they want to see a picture of the baby, they get an ultrasound. It gives you that black and white fuzzy image of that little bean in her belly. Ultrasonography for a massage therapist, we use the same tool, we just use it in a different way. Because we're not trying to get a picture, we're trying to generate heat. For moist heat, we can use heat packs and hot compresses. Again, you're talking about like a really hot washcloth that you stick on the body. Heat wraps, sprays and showers, and baths. We have immersion baths, we have air baths, and we have steam baths. So heating pads. Start right at the top again. Heating pads, you know what? I think we're adults. We know what a heating pad is, right? I'm sure that we know what a heating pad is. I don't have to sit here and explain that to you. But there is a highlight in this paragraph. It's the second to last sentence. The highlight says, some heating pads are manufactured for the application of moist heat. So that would be like the hydrocolator packs that we have in our hands-on room, right? They stay in that big metal box full of water. Those are heat packs for moist heat. Infrared radiation can be produced from a bulb or an element. Highlight, the warming effect of the sun is due to infrared radiation. Diathermy, this one is much more rare. There are very few places that I've ever seen that offer anything like this, but diathermy is the application of oscillating electromagnetic fields. Oscillating is a fancy word. It means wobbling. So we take two magnets, and then by moving the magnets, we move their magnetic fields, and that the energy in the oscillating fields causes a distortion in the molecules and an ionic vibration that produces heat. So you use magnets to shake the molecules. When molecules shake, that is what heat is. That is what heat is molecules that move more quickly than others. A diathermy machine is used to produce either shortwave or microwave radiation and transfer it into the tissues by cables or electrodes into the area of the body being treated. Again, that's a little more rare. Now, ultrasound is more common, usually because the application is a lot cheaper and people understand how ultrasound works, right? You're using very, very high-pitched sound, so high that our ears don't hear it, but sound is a vibration. And by applying this vibration to the body, it vibrates the molecules. And again, all heat is vibrating molecules. As molecules vibrate more quickly, the temperature rises. So under ultrasound, we are going to start highlighting. Therapeutic ultrasonography is a type of diathermy that uses sound waves of a frequency between 1 and 3 megahertz. This is much higher than what can be heard by the human ear. This produces a deep heating in the tissues, such as muscles, tendons, joint capsules, and bone. Stop highlighting there. Diathermy and ultrasound equipment require the use of specialized equipment and training that are beyond the scope of the practice of massage therapy. Now, there is a side note that I would like to make. Your book tells you it's outside of our scope of practice. However, the state of Florida does not agree. The state of Florida defines massage as the application to the human body of a manipulation, whether or not that manipulation is aided by a mechanical device. So in the state of Florida, the use of an ultrasound machine to create heat in the tissue, to have a therapeutic effect on the tissue, the state of Florida defines that as massage therapy, the manipulation of the tissues of the human body, whether or not that manipulation is aided by an electrical device. So in the state of Florida, massage therapists are allowed to use ultrasound machines for therapeutic purposes. We are not allowed to use ultrasound machines to show pregnant women pictures of their babies. That is imaging, that is outside of our scope. But we can use ultrasound machines to create heat in tissue, which will produce predictable therapeutic results. I just thought I'd throw that out there because your textbook is like, this isn't massage. State of Florida says it is. So in the state of Florida, we're good. Okay, any questions so far before we keep moving forward? Any questions so far?
No questions.
Okie dokie. So the next thing we're going to look at are on page 518, we're now looking at moist heat applications. We start out with paraffin baths. So a paraffin bath uses paraffin wax. They come in these like bricks. They're hard wax, but you put them in a special warmer, it melts the wax. This wax melts at a relatively low temperature, so it's safe to dunk your hand or your foot into it. I do want you to highlight the first sentence. A paraffin bath is one of the most effective methods of applying heat to relieve pain and stiffness. So you get all the benefits of an application of heat, right? All the things that we just talked about for applying heat, you get all those benefits, but you also get added benefits because paraffin is also a skin moisturizer. So that heat pushes some of the moisturizing materials into the skin, which the skin then absorbs, and it produces healthier looking, softer skin. You also get a very gentle exfoliation as any dead skin cells are stuck into that wax. So when you peel the wax off, and it literally, like once you take your hand out of the wax dries almost like a glove, and you can just slide your hand out of it, and you're left with this wax glove mold of your hand. It's pretty cool. But as that wax is removed, it takes some of that dead skin off with it as well. So you've got a very gentle exfoliation. The skin is left with healthier looking. The skin is left healthier looking. It's softer. So paraffin wax has a lot of really good applications. We can also use it on elbows. You literally just dunk your elbow in. You end up with this big spot of wax, then you peel it off when it dries. You could do this to your feet. But once you dunk that body part in the wax, you pull it off, and then you wrap the area in a plastic bag and then some kind of insulating material. They make special terry cloth like gloves and little booties to put on your feet that insulates the heat. So you leave those on for 10 to 15 minutes or until it no longer feels warm. And then you take the glove off or the boot off, you take off the plastic wrap, you slide your hand or foot out of that wax encasement, you throw it in the garbage. Rice packs are packs filled with dry rice. Rice is a really good conductor of heat. So you throw it in the microwave, you heat it up for a couple of minutes, that dry rice gets super warm, and then you put that rice pack on and you get the effect of the heat as the heat soaks. Excuse me, I got the burps. As that heat soaks into the tissue. Rice packs can be made in a variety of shapes and sizes, just depending on what you need. And if you're handy and you know how to sew, you can sew up your own rice pack. You just make a container, fill it with dry rice, sew it shut, throw the thing in the microwave, you're good to go. A hot compress is similar to a cold compress, except you've dipped a washcloth in hot water instead of cold water. You wring it out and hold it on the tissue. Moist heat packs are on page 519. Moist heat packs are generally chemical gel packs that are heated in a water bath, wrapped in a terry cloth cover, and placed on the body. Highlight this. A hydrocollator is used to heat and store the gel packs, which come in a variety of shapes to conform to different areas of the body. Now there's a picture of it on the right side of page 519. We're looking at figure 13-23. We have one of those almost exact, one of those contraptions in our massage room. That's why I have to keep going in there and filling up the water, keep topping up the water in the hydrocollator, because the heat will evaporate the water level goes down, you got to keep it full. All right. Body wraps. Body wraps use either wet or dry sheets and blankets to cover the entire body snugly, except the head. You leave the head kind of sticking out like a little burrito. Everything else is wrapped up. But we could, the purpose here is to elevate body temperature, almost simulating a fever, and to trigger sweating. We could also use wraps that incorporate substances like herbs or seaweed masks, which, again, when you start to sweat, it opens the pores, which means all the chemicals or materials in those herbs get absorbed into the skin. Showers and sprays. Hold on, my network connection is slowing, so you might lose me. Sorry. So showers and sprays. The only really one that I wanted to kind of pull your attention to is called a Vichy shower. There's a picture of one on the next page, page 520. The Vichy shower, you've basically got the client lying down on a special table, and there's a horizontal bar that runs over the table with a lot of little shower heads, and each of these shower heads is spraying down onto the body. So you can clearly see how this works in the picture on page 520. And that is a Vichy shower. There you go. Okay. So here we come to the point where your thing starts to list the procedures. We're not going to do any of this hands-on stuff, so we're just going to move past this. Next, we have learn the effects of contrast therapy. I think I did a good job of explaining contrast therapy. I kind of talked about it at length a few minutes ago. I do not have any highlights on this page. Oh, I lost my connection. Hang on. There we go. Sorry, internet is up and down today for some reason. So page 520 and 521, I do not have any highlights. We talked about contrast therapy earlier, so we're going to move past this. Page 522, we have a relaxing warm tub bath. You put the body into a tub full of warm water. Ta-da! A saline bath or a salt bath, you put them in a bath with salt water. Ta-da! Hot baths, you put the person into hot water. Ta-da! Now the next one is of importance. At the bottom of page 522, this one is called a sitz bath or a hip bath. I want you to highlight the first sentence of this one. This one is a little bit important. The sitz bath or the hip bath is applied only to the hips and pelvic region of the body, which is kept immersed in either hot, tepid, or cool water, or alternately hot and cool water. So the basic premise is this. You stick a person in a bathtub where they're kind of sitting down with their knees pulled up to their chest, and they're only in about 5 to 6 inches of water. So when they're sitting in here, only the bottom part of their pelvis, right, what's doing the sitting down there, and then like maybe up to their ankles, that's all the water that there is. I like to make it stick into your head. We call it a sitz bath because you sits in it. You just sits there. You sit in there, and the application of water is concentrated on the bottom part of the pelvic region. This is really useful for bladder issues, kidney issues, sex organs, also beneficial for hemorrhoids. So there are a few applications of a sitz bath, but you're generally only looking at like 5 to 6 inches of water. You just sit in it. It's just meant to get the bottom part that you're sitting on. Page 523, whirlpool bath. Highlight the first sentence. A whirlpool bath is a partial immersion bath in which the water is agitated to produce a slight pressure on the body. Now, this is one that gets students a little confused, so I want to take a moment to just explain this very briefly. When you think of a whirlpool bath, a lot of people are thinking of a jacuzzi, and you are correct. However, there is a distinction between a jacuzzi and a whirlpool bath. I just want to explain this very quickly. Kleenex is a brand of facial tissues. There are many different brands of facial tissues that all do the same job and they all do them well, but there is only one brand called Kleenex, right? Kleenex is a brand name. Band-Aid is a brand name for an adhesive bandage. There are many different types of adhesive bandages, but there is only one brand of Band-Aids, right? Jacuzzi is a brand name. Jacuzzi is a manufacturer of whirlpool baths. Not all whirlpool baths are jacuzzis, but all jacuzzis are whirlpool baths. Follow me here?
Yes.
Perfect. So a whirlpool bath, an example is a jacuzzi, but a jacuzzi is the brand name. The item itself, like adhesive bandage or facial tissue, is whirlpool bath. But most of us associate it with jacuzzi. We almost call all of them jacuzzis, almost like we call any facial tissue a Kleenex or any soft drink a Coke. Like it's not totally the same. Okay, you got it. We're good. Let's move on. Air baths. Air baths include steam and sauna baths, cabinet baths, and steam canopies. There'll be some pictures in here later, you'll see. Starting with steam and sauna baths, highlight the first two sentences. Heat in a steam bath is produced by a steam generator. Heat in a sauna is produced by a dry heat source. These are the differences. When you walk into a sauna, there is no steam. It is just hot. It is a dry heat. When you walk into a steam bath, it is steamy. It is a moist heat, right? There's like fog in the air. It's super hot, it's sticky, and there's a fog in the air. When you walk into a sauna, usually all the benches and stuff are made out of wood because they don't get hot very easily, but there is no mist or steam. It's just hot. So those are types of air baths, right? You're not bathing in water, you're bathing in air. A cabinet bath or a steam canopy, highlight the first sentence. Bath cabinets are also known as vapor or steam cabinets. Usually these are done with the person being in an upright or seated position, leaving the head exposed. So there's an example on the next page. Flip over to the next page, and you see like it looks like a big box with her head sticking out of it, and then you open the door and you see she's seated in there. So when she's seated in there, the box will fill up with steam. So you basically just sit in a steam box with your head sticking up out of it. It looks like some kind of Star Trek contraption, like that episode where the guy in the wheelchair and just his head was sticking out and he was blinking with the lights. If you've never seen it, it's a really good episode of Star Trek. You should watch it. But the last thing I'm going to talk about, and the very last highlight that we have, since we're talking about all these applications of heat, down at the section mark it says length of treatment. Highlight the first sentence. The exposure time in a cabinet bath or steam canopy ranges from 10 to 25 minutes. Last thing I'll pull your attention to is the picture at the bottom of the page. That is a steam canopy. You take a special table and it's basically like a pop-up, almost like a little tent or something. It's a little pop-up thing. Their head is sticking out of the top of it, but you pump steam into that thing. So the thing fills up with steam. Same thing like the the vapor cabinet. It's just instead of a hard thing with a door, it's just a canvas um, tent. Basically, you drop on top of the table, on top of the client's body. Be aware that heat treatments do induce profuse sweating. And when your body is sweating a lot, you're losing fluids. So it is very important that the person be given water to drink. They're encouraged to drink plenty of water because they've lost quite a bit of fluid through the sweating that we've induced through the application of heat. If the client gets a headache or any kind of like throbbing in the head or any other adverse reactions during the treatment, stop the treatment. Just take them out. All right, sir. Well, that has been chapter 13. Um, any questions? Any questions? Slow down, dude. I can only answer one question at a time. At 2 o'clock. There we go. Oh, there we go. We're back. All right. Sorry, I lost my internet connection again, Adrian. Any questions before we break for the day?
My bad. The connection was bad, but can you hear me now?
Yeah, I can hear you now.
All right, so I had a question about the whirlpool bath.
Yeah.
So could you explain it to me, please, how it is again?
A whirlpool bath? So
Yeah.
it's like a jacuzzi. It's a tub that has water jets put along the walls of the tub so that when the person is sitting in it, not only are you getting the benefits of the hot water, but you're also getting those mechanical effects because the water is being blasted onto the surface of the skin. So, and it's almost like a little massage. A lot of them have like pre-programmed um, patterns where these jets will turn on and off in a pattern so that you can get like a full body massage, or you can have it concentrate on your shoulders or concentrate on your low back. Um, but the benefits of it are you get the temperature benefits from sitting in the hot water, and you get the mechanical effects of the pressure of that water on your skin. And then if you added anything into the water like Epsom salts or herbs or essential oils, you would get the chemical effects of whatever chemical you added into the water.
Got it. Thank you. That is all. Thank you.
Cool. Well, that's chapter 13. So if you come up with any questions, please feel free to email me. You've got my Google Voice number, so you can shoot me a text message. I'll get to you as soon as I can. Now, if you text me at 10 o'clock at night, I probably will not text you back until the next day, but I'll get to you as soon as I can. But other than that, be safe, wash your hands, have a good weekend, and I will see you Tuesday at 2 p.m. right back here.
All right. Thank you, Dave. Thank you.
My pleasure. You have a good night, sir. I'll see you next week.
You too. Bye bye.